morning, everyone, and welcome to breakfast at Healthcare this morning on the 18th of December 2024. My name is Professor Sanjiv Mahadeva. I'm a consultant gastroenterologist, and today I have the honor and privilege of moderating and interviewing the eminent neurosurgeon, Professor Dr. Vicknes Waran. So today is a special session for Professor Vicknes Waran, as this great man from University of Malaya will be retiring in a month's time, i.e. in January 2025. And we are giving him the opportunity to tell us what the highlights of his career are, and more to share important developments that he has had in his career. So, Professor, for those of you who may not know, Professor Vicknes Waran has been in UM for a long, long time. I think, Vicky, when you joined University of Malaya, Professor Nazira was still in secondary school. I'm not sure, but he's been around for that long. And he's famous for many, many, many things. So there are many, many rumors about the achievements of Professor Vicknes Waran. Some say that he started neurosurgery in University of Malaya. Some say that he developed the subspecialties in University of Malaya neurosurgical unit, which have become one of the few units in the country with such subspecialty services. And some say, and this is the part I like the best, that actually he wanted to be a neurologist, but because he couldn't make it, that's why he ended up as a neurosurgeon. So, Vicky, we'd like to talk about some of these rumors that are floating around. Let's start off with, did you really develop neurosurgery? Was there nothing in UM before you started?
So firstly, I'd like to thank the organizers. I'd like to thank Neurosurgery for having nominated me for this spot. And I'm quite touched about it. Okay, so few misnomers. I never wanted to be a neurologist, didn't have the brain for a neurologist, but I did want to be a cardiologist, right? Number one, definitely not a physician or a gastroenterologist, God no. Okay, number two, I did not start neurosurgery. Neurosurgery had been in existence sporadically in University of Malaya from about 1967. But there was a period of 5 years when they did not have any neurosurgical services. So at a very young age of 37, I was asked by then Professor Anwar Zaini and then later Tan Sri Amin to come and would I like to set up a unit from scratch. So I was a young, naive 37-year-old, and I was given an opportunity at the premier university, my alma mater, to set up a unit from scratch. But it's not true. Neurosurgery has always existed. I had existed, but it was sporadic. Yeah, people came, people left.
So your joining University of Malaya was sort of an opportunity to develop something from scratch.
Yeah.
Yeah.
Yeah, it was. I mean, someone told me, come and we'll see what we can do and how we can develop this. So for 5 years, there's no one. So it was an empty slate.
Right. I mean, just again, this will be helpful for the young people. Did you have academic interests as well? And I understand you joined us from the Ministry of Health. And some people say that sometimes there's a lack of opportunity for developing academic interests in KKM.
So to be honest, I don't think I was academic. I was following the usual path. That means you go, you do a specialization, you come spend 3 years, and then you bugger off to private practice, right? I was very fortunate, however. I had a period of training in Japan, and I had a period of training in Addenbrooke's in Cambridge. And I had supervisors who hounded me to make sure I wrote my 2 case reports. Now, when I came to University of Malaya, it was purely an opportunity to develop things that I like. I like developing things, right? But I remember one day, I'll never forget, when Amin caught me on the corridor. And he said, Vicky, you seem to have done all this development, okay, but you need to actually publish some papers and progress. Okay, we would really like to make you a professor at some point. Okay, but you do need to publish something. Okay. And my interest has always been engineering development tools. And one of my seniors, when I was a trainee, said to me, if you're like your mother and you cook every day, you must have some recipe that you want to write up, right? So a lot of us just go through clinical practice, not reflecting on what we do. Okay, not trying to improve things that we do. I mean, my mother made muruku in a different way than other people made it special, right? So there were different things. So you don't have. I didn't have. Didn't I was not interested in proteins and genes. Didn't know what they were or didn't know much about them. But I was interested in tools and devices. Okay, somewhere it says someone wrote something and said wanted to be an engineer, and that's true. I always wanted to be an engineer. So there was always tools to be made. There was always improvements that one could make, and so I started publishing in that area.
Great. No, I mean, wanted to touch on that issue of publication. So because you're at the time of your career now where, you're coming towards the end, at least in public service. And
No,
many, I've seen and heard many eminent doctors, surgeons, physicians who at the end of their career wish they had, published even things like case series and much of the work they've done. So for younger people, you are saying that publishing, writing your experience, at least, leave alone clinical studies or etc., is important, correct?
of course it is. It's a reflection of what you do on a day-to-day basis, right? It is a reflection. Now, I think the problem is as doctors and super researchers, such as yourself, for example, set very high standards. Okay, so if all clinicians feel that they have to publish big series, if it doesn't mention the name of a protein in it, it's not good enough. But actually, there's so many other things that you can write about. No, I'll give an example. A few things. I do a medical legal thing. I do head injury management. Over the last year, I collected hundreds of patients, and it was just reports. And my wife was also helping me with this. And I caught a Maslina in rehab, and I said, "Hey, do you want to have a look at this?" And we have published 2 papers out of this, including a PLOS one. Now, it is something that we collected, and we made something out of it. So if you're in public service long enough and you have been doing work, you will realize where the problems are. The important thing is, I think, opening your eyes and identifying where the shortcomings are. That's the most important thing. And it doesn't have to be high science. There are many, many things that we doctors can learn about. Yeah.
Yeah. No, I totally agree, Vicky. Yeah, there is, of course, in medical journals and the literature, there's a overemphasis, if you like, on basic science, but you're absolutely right. I'm actually a clinical researcher. I'm not really a basic science researcher either. And I totally agree that there's a lot of science that you can show in various aspects of medicine. I mean, it's nice to see that I wasn't aware that you had published on your medical legal work and similarly on other things. So let's touch a little bit on you said you wanted to be an engineer. And of course, that interest probably has carried forward in your field, it's neurosurgery. Can you tell us how have you developed that neuro engineering part into your neurosurgical career?
Okay, so I wanted to be a civil engineer. Unfortunately, economy tanked at the time I was supposed to go to university. And someone said, people fall sick, whatever happens. So do medicine. And that's what I did. However, as a surgeon, we use lots of tools, right? I've written papers on communication. So we actually validated that images sent by a JPEG image on your handphone, right? And this was published in a tier 1 journal, right? In 2007 or something like that. So we have published on that. And a simple thing, right? We were communicating, right? We were sending messages, and this was before iPhones came along and all that, right? And this was like not quite engineering, but then there were tools and devices. I've had the honor and opportunity to work with a number of engineers. I got to know them because in north of Malaysia there are a lot of companies that manufacture, right? And they are interested in tools and devices we may have developed. So I worked with them quite often, paying out of pocket, sharing with them the cost of developing these things. I have had a long-suffering wife who has been what do you call that, supportive of the crap that I do. So I once wanted to create a port in a brain. So her job was tasked to creating jelly of different consistency that we thought was similar to the brain and freeze them in the fridge, and then do the videotaping as I drove this particular cannula into the head to see whether it cracked up the ice, the jelly or not, right? So, so yeah, that kind of things, right? And then and then we did Sigmit, and that gave me a great opportunity to help design a theater, right? And you see this, so because I have been working in an operating room for about 10 years prior to that. And when you operate in an operating room, okay, all of us notice the patient or the problem. But even the room and the environment that you work in is important, right? Or where the switches are placed, where is the power source coming from, where is the oxygen cylinder coming from. Sure, we have got engineers and biomedical people who supposedly tell us these things, but they're not the end users, are they? We are the end users. So you should know how your room is supposed to set up. And I'm sure your wife designed your kitchen for you, not you. Otherwise, it'd be a total mess. But, because we are familiar with it. So if we
Oh,
don't participate in it, we got ourselves to blame and we're given rubbish, right?
so for the yeah, sorry, I don't cut you
Go on, go
in.
on.
Just for those who are not familiar, you mentioned the word SIGMID. Can you just elaborate a little bit more? What is the
Oh, so
SIGMID?
so SIGMED was a center of image-guided and minimally invasive therapy. That's the bit that sits in Menara Timur, right? So in 2007, we were in our second generation of what we call navigation neurosurgery, and we were going to try and get another generation. And then we decided that, or I decided that, if you're going to do something, we might as well develop it for 10 years or 15 years rather than every 3-year basis cycles. And fighting for 3 million ringgit was going to be the same as fighting for 50 million ringgit. And so I wrote up a business plan, which was then, which members of the hospital helped tweak. And then initially we were going to go down the usual route of Rancangan Malaysia, whatever it was at that point, and that failed. So we decided to do a private-public partnership instead, and we trooped to Putrajaya to meet the people in the economic planning unit. We didn't know how to even get this going, so we just went to economic planning unit, made an appointment, went and saw them. And we had this whole bunch of clever people in the economic planning unit sit down and go through our plans. They formed little study groups, studied all the various aspects of it, tweaked the plan further, and then this plan went up to the Cabinet of Malaysia, who then approved of it. And then it came back down. Of course, we had all the input from various people, what they wanted. And eventually we found a private investor, put it in, and today it's coming towards its tail end, which finishes in about a year. And we published on that too, right? And I published on that too, which looked at the financial aspects of it and how we can provide high-end, very expensive care for poorer patients in developing countries.
Excellent, excellent. So, yeah, there's a question in the panel. I will come on to that in a second.
Heckler.
So there's this idea of yours for SIGMID. I mean, really, it's seems quite entrepreneurial, and this private government partnership. It's quite unique, right? I mean, how
It
many
was.
other places in Malaysia have such things?
So when we did it, it was the first of its kind, a private-public partnership in healthcare. It was the only one mentioned. Someone wrote up an article about all the private public healthcare that occurred in, no, so all the private public partnerships that occurred in Malaysia. And this gentleman, an economist, studied it at one point in the transitions of government we have had. So he was able to get all the data, and he said that this was the only one, it was the smallest public-private partnership, and it's the only one that didn't screw the government actually, right? And it was published in the Journal of Malaysian Economics. I hope I got the name correct. I've got nothing to do with it. It was written by somebody else, right? And then we felt so I got to know this guy, and together with my professor in Cambridge, we wrote the other paper, right? Yeah, I forgot the name
Yeah,
of the
no,
person.
that's great. That's great. I mean, you've achieved a lot of new frontiers in I would say not just neurosurgery, but medical development, etc. So one thing that we hear many people say, especially when they are trying to develop new services, always that administration doesn't listen to us, administration doesn't support us, but somehow you have managed to get things done, the kind of way you wanted to do. So I like your view on this, the fact that this administration is not supportive or blocking, but somehow you have managed to have people who've supported you. What's your trick? What's your answer for that?
Okay, if I take one step back, I think the most important thing is first is to develop human resource, right? It cannot be a one-trick pony, one-man show, right? So we had to have human resource. And so we developed the human resource first. That was the first step. And we showed that we had the people to run this platform, right? That's the first thing. I was also very fortunate in history, I suppose, that I was able to work with management people who were very forward thinking, right? And they existed. Just to give some names, like Tan Sri Gauss was the vice chancellor, right? He was a go-getter. He wants to push things. And I think the status of University Malaya today in his ranking is very much thanks to him. I had Tan Sri Amin, right, who was supportive all the way. I remember I went to him on my first day. I reported for duty and I gave him a 5-year plan. Okay. I gave that 5-year plan to other people as well, and they laughed at it, because nobody's ever given a 5-year plan for Faculty of Medicine for a division. But Tan Sri Amin actually took at it, read it, and called me back and said to me, okay, listen, you've asked for all these things. We can't give you everything one shot, but as you develop things, we will give it to you. And which he did. So over a period of time, things came along. Then there was Ikram, then there was Adiba, right? So I was very fortunate that they were willing to listen. And I was very fortunate that people in administration were open to listening. Doesn't mean that they agreed with everything that I had to say. They listened, they huffed, they puffed. We had discussions, and then we did it. So when we did SIGMIT, for example, Amin said to me, Vicky, you need to try Rancangan Malaysia. Both of us, I think, at the back of our minds knew that was not going to happen, right? But we wrote the plan, we sent it up, and it got rejected. And then Tan Sri called me back and said, I think maybe you need to go back to your original plan of private-public partnership, right? And that's what I did, right? So I took it back, looked at various people, spoke to 10. At that point, I was talking to anybody who wanted to talk about these things, right? So we spoke to 10 different groups at that point. And then finally, we went to the last couple of them who got vetted, and then, yeah.
So from this short story that you've told me, I get the impression that you're someone, not the fact that, people have supported you, but you're just someone is that dog with a bone, you won't let go of that bone, and you'll just go on gnawing until someone agrees to let you have the bone. So persistence is something you'd say is symbolic of your character.
I tell my boys always, ideas are dime a dozen. It's execution, perseverance. But you cannot also go and, you have to understand management, right? They have got million people coming up with million silly ideas, right?
Yeah.
So it cannot be half-assed, it cannot be half-baked, right? I have sat in as a head of surgery, and I've had colleagues come and say, I want this, I want that. But where's the paperwork, right? So you must make noise, and then you must have the paperwork sorted, right? And you must support them. I can't expect my former VC or former dean or pengarah, and all that, okay, to know what this image-guided surgery is. I need to sit down and explain to them in a language that they are going to understand it, right? And what is the implication for the institution? It's not just an implication for neurosurgery. What's the implication for neurosurgery? What's the implication? So you need to tell a story. So in some ways, I was a millennial then. I'm still a millennial now. It's all about storytelling, right? And to create a compelling story. The other problem is, I think, as I keep telling some of my colleagues who are in research in neurosurgery and other areas, is we have this attitude of paralysis by analysis, right? We think too hard. And today, looking at, I also will very honestly say, I don't think I can achieve half the things that I've done today in today's environment, right? Journals are very different. What they want you is to do different, it has to be multi-center, meta-analysis, God knows what.
But now you're starting to show your age, man. Come on.
Yeah. But you see,
whenever people start saying, oh, it was easier in my time, I did more in my time, and now it's harder. Times have changed. You just have to move with the change.
I agree, but also I think we hide behind committees, we hide behind a lot of these niceties, because is it okay? Now we debate this. Sorry to get into this, not supposed to be the topic, but we debate this thing, right? Do you always need a multi-center trial to tell you that what you're doing is good? There are other ways of proving it, right? And that is it. But I agree with you. Some things need a stronger level of evidence.
Okay, so let's move on to a different topic. There's a question from the audience about, I think it's a good time to take it and bringing it back to your specialty, about the current state of training for neuro surgeons. You want to say something about that for in the Malaysian setting?
Oh, this is a landmine, isn't it? Okay, so when I started, I was asked by my head of department then to try and set up a master's of neurosurgery. I was a one-man show, and I didn't think it was going to be fair for the country or the people who serve. And remember, I just live a couple of kilometers from the hospital. If someone had to crack my head, it's going to be somebody there. And I didn't think it was right for us to train in-house. Okay. And so my first loads of neurosurgeons, as you look at them, they are all trained abroad. They did 2 years, 3 years with us here, and then we got them jobs in places like Oxford, Cambridge. We also got them trained. Some of them had PhDs and stuff like that. So for a small division that had never existed, we developed very subspecialized people, very skilled people. At around 2010, 2015, okay, there were many more of us, and we felt that maybe we can now start a master's program, okay? And so we sort of embarked on it, and Waran managed to get that program through. Now the question is sustainability, right? Neurosurgery, where I trained, we had at that point 3 operating theaters operating every day neurosurgery, right? And we were only admitting Cambridge was only admitting 1 new registrar a year. They had 5 consultant neurosurgeons subspecialized, right? Till today, we don't have that kind of numbers, nowhere near that kind of numbers, okay? And yet we endeavor to train. But we also have to I suppose I've matured with time, and we also need to be able to meet national aspirations, right? But so I think it's important to train, give them a good, solid, basic foundation, which I think we are quite capable of doing. And then perhaps encouraging them to go further afield to get further exposure, to get them trained. Yeah. All this beating of chest about how good our programs are and all that, this argument about what do you call that, alternate pathways and all that, you know. I mean, we need people. I suspect personally that we are maybe overtraining even. Okay, I'm sure I'm going to upset a lot of people. But I think we have to have various kinds of training program. Otherwise,
Okay.
we all
So
become
the question from the participants was, apart from the current state, are they only trained to deal with trauma cases, or is it a comprehensive training program? What we have here in Malaysia.
In University Malaya, I can't tell you about everything else, but in University Malaya, we try and make sure that they're exposed to everything. So we are the only subspecialized unit, and I have neurosurgeons in our unit. We have neurosurgeons in our unit who do pediatrics, who do spine specialty, who do epilepsy, who do Parkinson's and movement disorders, who do tumor surgery, and I myself do endoscopic skull base. So we will be able to offer across board anything that you will see in a developed country if you went, the procedures done and the complexity to which it's conducted. And we're not just blowing trumpets, but you can do that. It can be seen. Question is, do we have the numbers to allow them to practice and do it to that level? So we can give them the exposure, we can give them some parts of the training, all that can be done. But are we able to then allow them to do because the number of patients are not sufficient? So that's the question we have to ask.
Okay, thank you. Thanks, Vicky. That's great. Now, time's running out. I'd like to come on to the topic that you and I spend hours and hours talking about over the years, and that is about staying on in government service versus leaving for the private sector. I know you have some very strong views. I mean, you're someone who I feel has, kind of bridged the gap. You have developed services in the public sector, and I think you've also done fairly well in our private wing, the Specialist Center. But the lure of private practice is very strong, particularly amongst your kind meaning surgeons. And we understand. I mean, we understand economics is economics, and cost of living is cost of living. But we still feel that there must be a better way than just leaving, right? Because you and I felt that otherwise there is an effect on the future generation, which many people don't seem to understand. Your views, please.
I think one has to take a very pragmatic view about this, right? When I first joined University of Malaya, there was a bet that ran around that I will last for 2 years. 1 year first, and then they increased it to 2 years, for which I won a dinner for 20 people at a restaurant because I stayed beyond 2 years. I remember sitting at another lunch about 10 years later. Ikram was sitting across me, and I said, if an opportunity arises, I will leave. And he looked at me and he said, I never thought you would leave. I said, no, of course I might leave. If the opportunity is better, it doesn't necessarily mean to be financial lure, right? It can be an opportunity. However, I was also very, very fortunate at the time I joined. The powers to be had set up UMSC. And UMSC is very, very important. But UMSC cannot work just by itself. Okay, it needs good leadership, right? And it needs to work very well with UMMC and the university. And it's very important. Now, if you look at neurosurgery, why did we do subspecialty? If one fellow claimed that he can do everything, then he will be king of the hill and there'll be nobody else. So it's very important on the leadership of different units to make sure that there's enough food for everybody. Now, if my boys didn't come along and do whatever else they did, I wouldn't be able to do the research and teaching and all the other rubbish that I did. So you need to develop these people, and you must be willing to share the pie. Now, was I afraid when I shared the pie that the pie might get smaller? The answer is, of course I was. When the very first other neurosurgeon joined and went private practice, I was wondering, like, shit, is my pie going to get smaller? The answer is no. By practicing subspecialty, sorry about the gardener cutting the grass in my neighbor's house, but as the subspecialties grew, our skill level improved and patients came looking for us, right? So today, almost every day, there's a neurosurgeon operating for UMSC. Yeah? And so it is up to us to set up and make sure that our juniors have a share of that pie. I hope I'm not too preachy, but I think that's important. And I think that's the point that is missed by the vast majority of the big fish floating in the water. I can be so brave and say all this because I'm coming to the very end. But that is the important thing. And I noticed as when I was running UMSC, the big fish are not willing to share. Right? As a consequence of which people leave. So then we say, oh, they are not happy, that's why they're leaving and all that. Actually, it's bullshit.
Right.
It's a
combination. But you're talking about big fish in all specialties, right? You're not just
big fish
talking
in
about
all
surgery.
specialties, not just surgery, in medicine, in obstetrics, in orthopedics, everywhere. It's a cross board, right? It's a cross. Some units have done it well. Some units have done it well. Not just neurosurgery. Some units have done it well. Most have not. And it's also a combination of administration, how supportive they are. People must see that if I don't earn, I'm not going to stay. That's a fact of life. I mean, you can't stay in the middle of Klang Valley and expect to live off a lecturer's salary or an associate professor's salary. You cannot. It's not going to.
So, okay, thank you. But what about, I was trying to get you to come on to the fact that if you stay on in the university, there's also the satisfaction that you're passing on your skill and knowledge to the next generation. How important is that? Okay, you're coming to the end of your career. How important is that to you?
What do they call it? Maslow's whatever. Yeah. Okay. I need to put food on the table first at home before I can start thinking of training people and developing research. That is the cherry on the cake, right? Now, if you don't have the base, it's not easy. So I've been fortunate. I was allowed to develop this, and my private practice also worked. My public practice also worked, allowed me to stay, train, do everything. And I hope that this will continue even once I have left the institution officially and come back to do some teaching and all that, right? But that must exist. Not all of us are born with a silver spoon, right? There are some people who stayed and continue to do research and teaching and all that. But the vast majority of us have families to feed, children to put through private school or public school or whatever, you know. And come on, most of them, to become a neurosurgeon, I had spent 10 years of training. The footballer earns more than me. A singer who can't sing earns more than me. I mean, so these kind of questions, real life questions, actually crop up, right? Which we forget. We forget. And it's easy sometimes people in administration to pontificate, right? It's very easy.
Yeah.
But it's up to us as seniors to make sure that the juniors have a place under the sun as well.
Yeah. So I think we're coming up towards the end of our time, Professor Vicknes Waran, but I think someone like you can, come towards the end of your career and look back that you've done it all, isn't it? At least in the field of medicine. You have developed your services, you have taught the younger generation. You've passed on your skill and expertise. Yeah, well, you're not going to be popular with everybody, and that's the fact of life. Everybody has a different taste, but are you going to leave next month from this job that you're going to have this satisfaction that you've done it all?
Just have I done it all? I'm happy. Okay, I'm in a very happy place at the moment. The institution has been absolutely marvelous with me, right? University of Malaya. You won't hear people say that, right? It's been an amazing run. But then it depends on the people who are there at that point, right? Of course, I want to come back. I've named Tuesday. I've told this to so many people. I've called Tuesday my karma cleansing day. Okay, to come and teach and do some research and do some stuff. Because after a while, it is addictive, right? It's addictive. I remember still when my name first appeared on PubMed for my first publication as first author, and I said to myself, is this the be all and end all? Okay, and that was like 20 years ago, and it becomes addictive. Yes, I would like to do that, but it also depends on how the institutions pan out and all those kind of things. Yeah.
Great. Okay, Vicky. I'm afraid our time is up. And ladies and gentlemen, we've had the pleasure and honor of time and wisdom from this great neurosurgeon, Professor Vicknes Waran. And just to let you know, he wanted a mere physician like me to expound on his greatness. That's because he's the archetypical surgeon, and of course, who lords over physicians like me. So, Professor Vicknes Waran, thank you for your time. And thank you for all your contributions towards University of Malaya, and happy retirement come 2025.
Retirement, you must be mad. Okay. All right. Thank you very much. Happy New Year to everybody.
Okay, right.